The first announcement stating that Indonesians in Indonesia have tested positive for COVID-19.
The first two known cases of COVID-19 in Indonesia made headlines on March 2nd, 2020. Since then, Indonesia, like many other nations, began seeing a surge of cases rising exponentially. The government soon declared a state of emergency, declaring the first ever lockdown or large-scale social restriction or PSBB in major cities like Jakarta and Surabaya. Schools, offices, and the entire tourism sector were closed. Despite all the efforts, most of the public were still adjusting to the realities of the new normal, and as cases were continually rising daily, so was the death toll count. Indonesia already possesses a glaring struggle to provide equal distribution, productivity, and quality of healthcare throughout the archipelago to a population of approximately 260 million. With only 2,488 hospitals, and the doctor-to-patient ratio of nearly 1 to 17,000 compared to the WHO recommendation of 1 to 600 doctor-to-patient ratio, the condition of Indonesia's healthcare system is one of the lowest in Southeast Asia. Therefore, with a new and growing pandemic blazing through, these obstacles pose an even greater challenge to the readiness of Indonesia tackling COVID-19. Immediately, the nation faced a tremendous shortage of personal protective equipment or PPE across clinics and hospitals. The inability to procure these protective gears led many of the medics without any protection or forced to resort to using makeshift gears such as rain jackets. These have unfortunately led to many medics falling ill and dying. And with Indonesia's general shortage of medical manpower, these losses of over 647 doctors and nurses to date due to COVID-19 is extremely detrimental for the nation. With the support of generous donors, doctorSHARE was able to procure and distribute 1,450 PPE packages to 629 health facilities across 34 provinces in Indonesia. The packages consisted of at least coveralls, gloves, KN95 masks, face shields, boots, goggles, and vitamin C. As more and more positive cases flooded hospitals, we also began to see an over-occupancy in intensive care and isolation units, as well as the lack of ventilators. With the shortage of only 8,600 ICU beds in the whole archipelago of 260 million people, only less than 50% of these ICUs are equipped with ventilator units. The shortage of ventilators have sadly resulted in many with COVID-19 suffering from eventual respiratory failure without aid, as medics are left to either reject patients due to over-occupancy or to choose between the young and the old for the life support. doctorSHARE was able to procure and distribute 10 units of Air Liquide France Monol T60 ventilators to 10 COVID-19 referral district hospitals within 5 provinces. Each ventilator has benefited 5 to 8 patients on average within the course of 4 months. Apart from these challenges, The simple lack of public awareness and compliance in health protocol implementations are evident, especially in areas where poverty looms and access to quality education is limited or non-existent. Many are simply oblivious and/or ignorant. Therefore, doctorSHARE felt the importance in promoting ways to minimize the risk of contracting COVID-19 through home visits and small community meetings in Central and East Java. Through solid coordination with the local government, the team managed to reach 2,887 community members without gathering any crowds. During the second half of the year, doctorSHARE also actively brought our medical facilities to regions that did not have any access to healthcare support, as COVID-19 does not replace other diseases. In September 2020, Dr. Lee Darmawan Floating Hospital birthed at Pesawaran District, Lampung, and provided outpatient treatments and consultations to 446 non-COVID-19 patients in 2 villages, Pahawang and Pagarjaya. doctorSHARE's largest floating hospital facility, Nusa Waluya 2 floating barge, sailed to Lingga Islands in Riau Province and conducted medical services in Senayang and Davao sub-districts, treating 3,940 patients with both general treatments and specialist services, as well as promoting health and hygiene awareness on top of COVID-19 preventions. The barge is also well equipped with a full PCR lab equipment that serve not only as pre-treatment testing for patients with suspected COVID-19 symptoms, but also supported the entire Lingga district and local government who did not at all possess this type of facility in their region. doctorSHARE's decade-long work in providing medical support and accessibility across Indonesia, especially in the rural regions of our archipelago, have given us an advantage in connecting to the needs on the ground. As we continue to see the urgency of needs rise, we also saw the output of generosity extended by so many of you. Because of you, we were able to play a part in helping many in Indonesia's fight against this pandemic. On behalf of doctorSHARE, we want to sincerely thank all of you for your tremendous generosity, time, in-kind donations, and partnerships this past year. It has been one of the most difficult years for all, but you have helped us make it meaningful. Thank you.
Terima kasih.